before entering the room, I'm going to first gather my supplies. I'm going to make sure that I'm wearing a face shield and face mask. I have my tray kit, my suction catheter, my disposable container, the inner cannula, sterile saline, and trach stabilizer. So now that I have my supplies, I'm going to enter the room, knock, knock, knock. Upon entering the room, I'm going to perform hand hygiene for a full 20 seconds. Good afternoon, Mr. Jones. My name is John Michael Lozada, and I will be your student nurse today. Now, I understand that you are having some difficulty speaking, so if I could have you give me a thumbs up for yes, a thumbs down for no. You could also raise your hand if you have any concerns or if you're feeling any pain or discomfort. Now, is that understood, Mr. Jones? Thumbs up. Great. Now, Mr. Jones, can I have you confirm that your full name is Jim Jones? Thumbs up. All right. And that your date of birth is March 10, 1994? Thumbs up. All right. Let me go ahead and scan your armband. Okay, that matches. Now, Mr. Jones, do you have any allergies, specifically to chlorhexidine or latex? Thumbs down. And are you experiencing any pain at the moment? Thumbs down. Okay. Now, Mr. Jones, today we are going to be suctioning the secretions from your tracheostomy or the opening in your neck. This should allow you to breathe much better. We're also going to be switching out your inner cannula, cleaning and assessing the site, switching out your dressing, and then finally we're going to switch out your trach stabilizer. Now, do you have any questions or concerns about what we will be doing today? Thumbs down. Have you had this procedure done before? Thumbs up. Okay, and so you have a pretty good understanding of the procedure today. Thumbs up, great. Now, Mr. Jones, let me go ahead and check your vitals before anything. Your blood pressure, your heart rate, and temperature are within normal limits. I'm also checking your respiratory rate is 22, and your oxygen saturation is 92. It's a little bit low, but the suctioning should help out with that. Now, Mr. Jones, do you have any shortness of breath or difficulty breathing? Thumbs down. And do you have any coughing at the moment? Thumbs up. A little bit of coughing? Thumbs up. Okay. Now, Mr. Jones, I do notice you're not using your accessory muscles to breathe, so you're not exerting any extra effort when breathing, so that's good. Now, Mr. Jones, is it okay if I listen to your lungs underneath your gown? Thumbs up. Okay. Now, I've already cleaned my stethoscope before entering the room. I'm going to go ahead and listen to your lungs now. Give me a good deep breath in and out. 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 Okay, Mr. Jones, I do notice that you have a bit of gurgling in your upper airways, but again, the suctioning should help out with this. Okay, I've already assessed my patient. Now it's time to ensure that I have all my emergency bedside equipment. I'm going to make sure that I have 2 extra trachs, one trach a size down, a size 6, and one matching his current size of size 8. I'm going to make sure that I have my extra inner cannula. I have my ambu bag attached to my oxygen supply running at 100% oxygen. And I have my suction catheter attached to my suction canister running at 100 to 120 milligrams mercury. Okay, so I've checked that. I'm going to perform hand hygiene, 20 seconds, and don a pair of gloves. Okay, so I'm going to prepare my work area now. I'm going to start by wiping down the tabletop for a full 30 seconds. Starting now. All right, Mr. Jones, so before we suction your secretions, it's really important that we hyperoxygenate you. And by that I mean I'm going to give you a couple breaths. That way your oxygen level is maintained throughout the duration of the procedure. Now, do you have any questions or concerns about that? Thumbs down, great. Making sure to grab all the edges here. I'm going to dispose of that. I'm going to allow it to dry for a full 2 minutes. I'm going to place my supplies on top. All right, I'm going to doff my gloves, perform hand hygiene. I'm going to close the door, close the curtain to give us some privacy. I'm going to raise the head of your bed, Mr. Jones. Is that okay? Thumbs up. Okay. I'm going to put it into a semi-Fowler's or a high Fowler's position in order to aid with proper breathing. I'm going to perform a hand hygiene, don a pair of gloves. And I'm not sure when this suction catheter was last used. So let's go ahead and switch that out. And open the new one. Place it. And while I'm here, I'm making sure everything is working and turning on properly. So I'm turning on the suction. That's working. Also checking the oxygen as well. And the oxygen is working as well. All right, so I'm gonna go ahead and open my tray kit now. Making sure to only touch the outer edges. We don't need the sterile gloves, so I'll dispose of that. I'm gonna hit the sterile drape on our patient now. Making sure to only touch the top 1-inch border of the drape. And place it on the patient like so, just in case your inner cannula drops and has somewhere to land. I'm gonna grab the inner cannula. I'm gonna place it in the kit like so. Drop that in. I'm going to open up our box here. Grab the sterile saline, open it, fill that about halfway. Also into the tray kit, dispose of that. Dispose of my gloves, perform hand hygiene. Got another pair of gloves. All right, Mr. Jones. I'm gonna oxygenate you now. So as I remove his oxygen supply, I am stabilizing the faceplate, like so. As I put the ambu bag on, I'm stabilizing the faceplate. Place it. In between each breath, I'm counting a full 6 seconds. So breath number 1. 1, 2, 3, 4, 5, 6. Breath number 2. All right. So as I remove, I'm stabilizing the faceplate. Taking note of his oxygen saturation, it did went up to 98%, so that's good. So now we're gonna go ahead and begin to suction. I'm gonna take it out about 3 inches. And I do notice that the pressure is set to 120, but when I place my thumb, I do notice the pressure did go up quite a bit. So I'm gonna adjust it back down to 120. All right. I'm gonna grab a bit of saline to ensure the function. Okay, that's working. Okay, Mr. Jones, we're gonna begin suctioning you now. All right, you ready? Thumbs up. All right, here we go. Okay, Mr. Jones, not too bad, right? Thumbs up. Okay, do you require any more suctioning? Thumbs down. If you did require more suctioning, I would wait a minimum of 30 seconds in between each suction. And I do notice his O2 saturation is at 98%, so he requires no hyperoxygenation at this time. So what I will do, I will grab a bit of sterile saline to clean it, place that down, replace his oxygen. Now, Mr. Jones, are you feeling any respiratory distress or shortness of breath at the moment? Thumbs down, okay. All right, I'm gonna doff my gloves. I'm gonna perform hand hygiene and don another pair of gloves. Are you doing okay, Mr. Jones? Are you in any pain at the moment? Any discomfort? Thumbs down, okay. All right, so now we're gonna switch out your inner cannula. I'm gonna stabilize your faceplate as I remove your oxygen. Okay, so since I'm already stabilizing, I'm going to go ahead and remove his old inner cannula. I'm gonna unclip it, Carefully remove it, dispose, grab his new inner cannula, making sure to only touch the top. Gently place it in and clip it in, like so. Okay, while I'm here, I'm already stabilizing, so I'm going to remove his dressing carefully, like so. All right, Mr. Jones, are you breathing okay? Any respiratory distress or anything like that? Thumbs down, okay. All right, so while I'm here, I am assessing the site. I'm checking the stoma, making sure that there's no redness, no inflammation, no swelling. Everything appears to be clean, dry, and intact. I'm also checking the trach itself, the faceplate, the inner cannula, and the trach stabilizer, making sure the quality is good. There's no tears and no breaks or anything like that. Everything seems to be normal. Okay, so now that I've checked that, I'm gonna go ahead and begin cleaning. So I've already dropped this saline in here. So I'm gonna grab one Q-tip, dip. I'm gonna stabilize. One swipe underneath, and that's gone. I'm gonna grab the second Q-tip, dip, stabilize. One swipe on the top. And now I'm going to grab the wet gauze. Wipe the faceplate. Like so. Remove that. Another wet gauze. And wipe the skin around it. All right. Dispose of that. There's no need to wipe underneath the faceplate at this time because there's no excessive secretions. So at this point, I'm gonna go ahead and grab the dry gauze. Pat it dry, pat, pat, pat. Pat, pat, pat. Dispose of that so there's no extra moisture. And finally, I'm gonna grab the split gauze and apply his new dressing. Making sure to stabilize. As I place it in. All right, Mr. Jones, not too bad, right? Are you feeling okay? Thumbs up, great. Okay, let me go ahead and replace your oxygen now. Okay, Mr. Jones, I'm going to grab my second nurse and we're going to switch out that trach stabilizer. Let me go ahead and dispose of my equipment here. Okay, and before I go, I'm going to put your bed in the lowest position. I'm going to put both your side rails up. I'm going to put your call bell right next to you, and your environment looks to be safe. I'm going to remove my gloves and perform hand hygiene, and I'll be right back with my second nurse. Knock, knock, knock. All right, Mr. Jones, we're back. I'm going to perform hand hygiene, 20 seconds. I'm going to don a pair of clean gloves. Let's go ahead and switch out that trach stabilizer. You can remove your sterile drape, you won't be needing that anymore. And let me go ahead and call in my second nurse. I'm gonna have her wear a face mask and goggles. And I'm gonna have her perform hand hygiene and don a pair of clean gloves. So go ahead. All right, before I remove your oxygen supply, let me go ahead and assess your vitals. Everything is within normal limits, and your oxygen saturation is at 98%. So let me go ahead and stabilize your faceplate and remove your oxygen. Okay, so if I could have my nurse stabilize her side as I remove my side. I'm gonna grab the new stabilizer. Dispose of that. I'm gonna place one side in as my nurse continues to stabilize. Now, Mr. Jones, is it okay if we turn you on your side? Thumbs up? Okay. Gently turn him over. And while I'm back here, I'm assessing his neck. I am making sure there's no redness, no inflammation, no swelling. Everything appears to be normal, clean, dry, and intact. So let's go ahead and slip these underneath. As well. All right, slowly set them back down. Are you doing okay, Mr. Jones? Thumbs up, very good. I'm gonna stabilize my side as my nurse fixes her side. To dispose of the old stabilizer. All right, before you go, nurse, let me go ahead and ensure the fit. Gonna make sure at least 2 fingers fit in there. That way it's snug, but not too snug. All right, thank you, second nurse. I'm gonna go ahead and replace your oxygen now. Okay, Mr. Jones, are you in any pain at the moment? Thumbs down. Not too bad, right? Thumbs up. Do you have any questions or concerns about today's procedure? Thumbs down. Okay, let me go and doff my gloves and perform hand hygiene. And let's go ahead and switch out that suction catheter since we already used it. Dispose of the old one, grab the new one. Okay, place that down right there. All right, Mr. Jones, we're almost done. So before I go, let me go and assess your vitals once more. Once again, your blood pressure, your heart rate, and temperature are within normal limits. Your respiratory rate is at 20, and your oxygen saturation is at 98%. Okay, are you experiencing any shortness of breath or difficulty breathing? Thumbs down. No respiratory distress. Thumbs down. And do you have any coughing at the moment? Thumbs down. And I notice you're not using any of your accessory muscles to breathe, so that's good. You're not exerting any extra effort. So now, Mr. Jones, is it okay if I listen to your lungs underneath your gown? Thumbs up. Okay, I already cleaned my stethoscope. Breathe in and out, 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 in and out. Okay, his lung sounds are clear and equal bilaterally. All right, Mr. Jones, we're pretty much done. I'm gonna doff my gloves. I'm gonna perform hand hygiene. I'm going to put your bed in its lowest position. I'm going to put your call bell right next to you. I'm going to put both side rails up. And I'm checking your surroundings. Everything appears to be safe. Perform hand hygiene once again. Now, Mr. Jones, if you have any questions or concerns, feel free to ring your call bell, okay? All right. Thank you. Okay, so upon leaving the room, I'm going to document the date and time, the patient tolerance of the procedure. He tolerated it pretty well. He experienced no pain. I'm going to document the site assessment of the stoma. There was no redness, no inflammation. No swelling, everything was clean, dry, and intact, and his sputum displayed minimal thin white secretions. All of his vital signs were within normal limits, and his oxygen saturation was at 98%. Also, he experienced no difficulty breathing, no respiratory distress, or any coughing or shortness of breath of any sort. Thank you.